Hi, my name is Amaya, and this is my group members.
Brianna.
Janaisha.
Curtis.
And today we'll be talking about hepatitis C.
This is fact versus fiction. Hepatitis C is not transmitted by casual contact, kissing, coughing, sneezing, or sharing eating utensils. Hepatitis C can be spread with the infection of blood. Some people don't know they have hepatitis C until they have liver damage.
Oh, hey there. There are a lot of identifying resources to help with the hepatitis C. First is the White Ryan Care Act. It's a federal care of the medical and it helps with the funds of it. Next is the CDC. It stands for Centers for Diseases. It controls and prevention. However, there is the American with Disability Act, which it protects HIV/AIDS, people with public work and school, and even more.
This is at-risk behaviors. Hepatitis C is a contagious disease that's transmitted when the blood of an infected person enters the body of a person that's not infected. Hepatitis C is a complication including chronic liver disease, carcinosis, irreversible scarring of the liver, and liver cancer. Hepatitis C is the inflammation of the liver, and hepatitis C is the liver's inflammation caused by the hepatitis C liver.
Infection control standard precautions. The CDC creates standard precautions to protect healthcare workers and to protect patients. And then you got transmission-based precautions. Direct touching an open wound or having a sexual relationship with an infected person. And indirect inhaling air after a sneeze or touching soiled bed sheets. There are 3 blood-borne pathogens that healthcare workers are at an increased risk of getting are HIV, hepatitis B, and C. The agency that developed the blood-borne pathogen standards is OSHA.
What's up, y'all? These are the legal aspects of hepatitis C, public health. Hepatitis C is a reportable disease, which means that when a person is diagnosed with HCV, his or her name is given to a local, provincial, or territorial public health. At work, hepatitis C infection is considered a disability under anti-discrimination law. In Canada, it is legal for an employer to harass or discriminate against a person because of a disability, even if the only thing that limits the person's ability to do the job is prejudice or stereotypes about the disability. Having sex. Under Canadian criminal law, a person with a sexually transmitted infection has a legal duty to tell his or her partner about that infection before they have sex, if the sex will involve a significant risk of serious bodily harm. Sharing drugs and drug equipment. The criminal law in Canada is not clear about whether a person has a duty to disclosure his or her hepatitis C virus infection when sharing drugs and drug equipment. Under public health law in some provinces and territories, people have a legal obligation to not pass infections such as HCV. In other words, to protect drug sharing partners from becoming infected. Description of hepatitis C, a form of viral transmitted in infected blood, causing chronic liver disease. It was formerly called non-A, non-B hepatitis. Signs and symptoms: upper abdominal pain, especially on the right, dark urine, light-colored bowel movements, jaundice, yellowing of the skin and eyes, nausea and upset stomach, low-grade fever, and chills, muscle aches, etc.
This was facts and fiction and identified at-risk behaviors.
The identifying resources.
Infection control.
And legal aspects of hepatitis C.